Indiana in the Morning, presented by First Commonwealth Bank on WCCS 101.1 FM, AM 1160, WCCSradio.com. Our interview segment presented by Marcus & Mack, voted best personal injury law firm in the Best of Indiana County contest. Marcus & Mack, a law firm representing injured people. And our interview is also being streamed on our Facebook page, so you now see on there, if you're watching, and you will soon hear, if you're listening, Dr. Tyler Watson, a sports medicine physician with Indiana Regional Medical Center. Dr. Tyler, good morning. How are you doing?
Good morning. How are you?
I'm doing excellent. Yourself, sir?
I'm doing great.
Excellent. Glad to hear. So, obviously, let's learn a little bit about you. First off, where are you from?
So I'm from Western PA. I've been a Western PA guy my whole life. I grew up in Uniontown, about an hour and a half south of here.
Okay.
Went to college at W&J, so I spent, the first 20-some years of my life here in Western Pennsylvania.
William and Jefferson, right?
Washington
and Jefferson.
Yeah.
I'm sorry. There are a lot of
There's
W&Js.
a lot of W&Js around here.
All right. And so that's where you went to school.
Yep.
What got you interested in going into medicine?
So I had a lot of family stuff that happened. My grandfather battled cancer for maybe 10 years, and I was actually the first one in my family to go to college, let alone into medical school. Mm-hmm. And so I had some, nobody in my family ever knew anything about medicine, really, so it was nice to be able to be the person that could facilitate that for them.
All right, excellent. So obviously you're a Western PA guy. I don't need to ask you how you find Indiana, but you said Uniontown. Is it kind of a different culture shock?
I'd say it's pretty similar. I think Indiana County, Westmoreland County, and Fayette County are all sort of similar. They're not in the city.
Not in the city, but still kind of close enough that you can access it if you need to.
Feels like home.
All right.
For sure.
Now, you're in the specialty of sports medicine, so maybe you can explain to our listeners, what is sports medicine? So
sports medicine, sort of big picture, we deal with a lot of musculoskeletal complaints and a lot of different, and the main thing we deal with is concussions, too. Mm-hmm. So,
obviously concussions have been the forefront of a lot of discussion when it comes to sports injuries.
Sure.
So, all right, so muscle, skeleton, and sports medicine doesn't need to necessarily mean you were playing touch football with your friends.
No, it doesn't. In our office, we work with all the local high schools around here. I also work in Johnstown as well, so I work with the high schools up there too. And we work with Indiana University, so we do work with a lot of athletes. But, we take care of the general public for anything head to toe, whether that's shoulder pain, elbow pain, wrist pain, hip pain, knee pain, and all the above.
You mentioned concussions. Is that the most common thing you treat?
Yeah, I would say it's one of our big things we see in the office. I mean, it's just, not only do we take care of concussions in athletes, but just the general public overall, we take care of that too.
All right. Touch on that sports concussion program a little bit over at IRMC.
Yeah, it's been, I've been there for almost 2 months now, and we do a great job of getting the patients in basically as soon as they get their concussion. So we prioritize trying to get them in as soon as we can. But there's lots of different things we can do in the office. I think number one is always listening to the patient. That kind of gives you listen to their symptoms and let them kind of drive the boat in terms of where it should be. But there's lots of different ways we can manage it with medicines, whether that treats their headaches, the emotional things that they can have from the concussion, help them get back to school, to work. We do work really hard to get them back to their normal function of life.
Now, how can a concussion be prevented? Obviously, the biggest thing is to probably avoid risky activities in certain regards, but sometimes it just happens.
Yeah, I mean, a lot of it is prevention, but being aware and making awareness part of recognize you have a concussion is a big thing. It's different. Like if you have a rash on your arm, everybody will see it, you will see it. But in terms of concussions, you have to be honest with yourself and recognize that, hey, maybe something's off and it's maybe something I should go get checked at by a doctor.
Now, we used to think of concussions as people like, oh, I'm seeing stars, things like that, and I'll just shake it off. But no, this is really serious stuff because this is serious damage to the brain, and we've seen what repeated concussions can do.
Yeah, and it's been a big thing. I think there's been a big push in the past 20 years to bring concussions to the forefront, not only just in athletes, but in the general public. And I think it's been great because it really does have short-term and long-term consequences if not recognized and treated appropriately.
Talk about the types of treatment a patient would receive after having a concussion if they were to come to IRMC.
And I think it just depends on what type of symptoms. I mean, I think the classic symptom is kind of how you described.
Seeing stars.
Yeah, seeing stars, feeling sort of in a fog, being confused. But, sometimes people just aren't feeling the same, have insane headaches, have emotional concerns all over the place. So we can certainly work at treating and getting them back to their normal.
All right, and it is different for every individual person. There's no cookie cutter way.
There's not, and we do a lot of in-person tests in the office, which kind of help give us some objective data, and we also use some computer-based algorithms to give us a number that we can help compare. Is your concussion getting better more than you just saying yes? So we do have some things in the office that we can do that gives us something measurable.
You mentioned one other important part about this, and I think it is the fact that communication between patient and doctor is key.
Yeah.
And the fact that you can't lie to yourself on this. But again, it's that communication factor, being honest with the doctor, being honest with yourself in many regards, and not trying to tough through this because, again, there's that stigma attached. Oh, you got your head rattled. Just shake it off, walk it off. You'll be fine. A few gulps of fresh air, you'll be fine.
Right.
Never the case.
No, it's not the case. And that's when, sitting down and listening to the patient, and, they know themselves better than anybody else. So if they think something's wrong, then listen to them and get them treated the way they need to be treated.
What are some of the other common injuries that you might treat if somebody were to come to sports medicine?
And I think we deal with a lot of shoulder injuries, elbow injuries, wrist injuries, a lot of just extremity, hip injuries, knee injuries. A lot of non-surgical musculoskeletal.
If anybody knows me, they knew that I went through the worst last year because I had a fracture in my wrist. Okay. And I think I suffered a kind of a similar sport. I wouldn't call it a sports-related injury, but I tripped and I fell on the sidewalk and I put my arms out in the wrong way. You know how that goes.
Such a classic thing.
But it was a very small fracture. Yeah. So it's kind of amazing how people how different that can be done. I mean, you're at that point also you're thinking about range of motion as well, I would assume, with that, and trying to get people to recover from those types of injuries.
Right. We do a lot of fracture care in our office, and I work at both the Johnstown, Indiana, and the Indiana office, and somebody comes in with concern for a fracture, we can get them an X-ray same day. Then we also, have the equipment in our office to manage and treat their fracture. We work with orthopedics, we work with therapy, so really is an all-inclusive group in our facility to get them better.
It's amazing sometimes how wide-ranging sports medicine can be. I mean, again, we hear about it. We hear about it all the time whenever we're watching sports, or they're like, oh, they're going to be taken to such and such and so, and they're getting best care anywhere as far as that's concerned, or how much privacy does come up with that thanks to the HIPAA laws and things like that. You see the people going into the tent, you know what I'm talking about. But when it comes to sports medicine, I mean, people see it and they hear about it enough. But it's nice to know that there is like a clear definition of what that is.
And it's good to keep in mind that it's not just for athletes. So I did my training at Virginia Tech and at Auburn University.
Oh, nice. Yeah.
But it doesn't mean that we only take care of athletes. I mean, it has that label to it, but most of our population is
it's basic
anybody that has a musculoskeletal complaint, a strain, a sprain.
Who knows? I might have been in the auspices whenever I had my fall last year.
Right.
Oh, please, let's not go through that again.
And especially since it's the first day that it's been snowing and it's
and that's the thing too, because people are going to get slip and falls, walking even on the sidewalk on icy conditions like this. So, best thing to do to kind of prevent slip and falls, because because you just touched on it. It's slick out there.
Sure.
Walking, just kind of preventing the slip and falls. What can people do?
I mean, I think having good shoe wear is important. I mean, having a good base that has some tread to it, especially when you're walking on the snow. I mean,
okay.
There's not much you can do if you slip on ice. That's
you become a human physics experiment at that point, or if you trip on something. But I think one of the best things, and I think you and I kind of touched on it whenever I was talking about it. If we start falling, just kind of roll with it, almost.
Yeah, and it's hard because a lot of times your body just wants to just
react
yourself and react, and a lot of times you stick your hands out or you do something, and
all right,
whatever you land on absorbs the blow for sure.
All right, let's ask. You said your offices are in Indiana and in Johnstown.
Yep.
All right, where's the Indiana office?
It's across. It's basically right next to the hospital. It's in the Human Motion Institute.
Okay.
Which is you look outside of our door, you can see the hospital from it.
All right, excellent. And how can they get a hold of you if people want to avail themselves of your services?
You just call our office. We certainly have people. We can see people same day or the next day, so we've been able to get people in pretty quickly.
All right. And the Johnstown office, where's that at?
It's up in Richland.
Okay.
It's near it's right as soon as you get off the exit. It's by TJ Maxx, Hobby Lobby, Walmart.
All right. So that neighborhood. Gotcha. Okay. Yeah. So it's great to know that there are two offices available for people all across our area to do that, and it keeps you busy because you're probably running back and forth between both offices.
Yeah, so I split my time between the Johnstown office and the Indiana office, and it's been good. And each office also has lots of different providers. We have some PAs in our office. We also have orthopedic surgeons in the office, so it's really an all-inclusive facility to take good care of people.
All right, we're talking with Dr. Tyler Watson, a sports medicine physician with Indiana Regional Medical Center this morning here on Indiana in the Morning. And Doctor, if there's one takeaway, I think if people have one takeaway from this segment here talking about sports medicine, what do you want to get across to our listeners?
I would just say if something's bothering you, come see us. We'll take care of you. We'll listen to your complaints, and whether that's me or one of my partners in the office, we'll get you seen as soon as we can.
Dr. Tyler Watson, thank you very much for joining us on Indiana in the Morning. Hey, please come back anytime you like. We'd love to have you.
Sounds good. Thank you very much.
Thank you. That's Dr. Tyler Watson, sports medicine physician at Indiana Regional Medical Center, joining us on Indiana in the Morning. Our interviews are presented by Marcus & Mack, voted best personal injury law firm in the Best of Indiana County contest. Marcus & Mack, a law firm representing injured people. It's 8:21 here on Indiana in the Morning, so we're going to take a quick pause. Pun fully intended.
Take a pause.
Our family arguments